Hello and welcome. This is a demonstration of the Emerald software. Emerald is a software application that has been developed by Emrald Technologies Private Limited, Bangalore. This software application is designed to help radiologists to prepare detailed radiology reports quickly, efficiently, and without errors. What we will do in this demonstration is take you through the process of creating a report with various abnormalities marked. Let's get started. Emerald is generally pre-integrated with a billing system such as Billbook. Billbook is a software from Emrix Technologies which helps radiology labs prepare bills at the front office. Emerald works equally well with any other billing system that you might have, or a hospital information system or lab information system that you might be currently using. Emerald can be integrated with any such system. Once such an integration is done, what you will see is right there on your screen, you will see what we would call a patient queue. The patient queue is the list of patients who are waiting, in this case, for ultrasound scans. And this queue is populated with all the names of the patients as and when they arrive into your lab. So let's say that you have now one Mr. Srinivas who is here for a scan, and he is here for an abdominal ultrasound scan. So let's see how to make a report, a radiology report for this patient. First off, you might want to note certain clinical data that might be relevant in this case. So you just go there and fill in the relevant clinical data. For example, it could be abdominal pain. Then you proceed with the report. What you will see here are a bunch of templates which are most closely related to the test code that was entered at the time of billing. The one that matches best is this, the male abdominal pelvic ultrasound scan. So you pick that and proceed. Yeah. Now here we are. This is the primary screen that shows you how the Emerald software looks, how you can use it to make reports. So on the left-hand side, with all these green bars, you have a list of organs which are part of the scan. So it could be the liver, the gallbladder, the pancreas, and so on. Then the kidneys, all the way to prostate, bowel, and abdominal wall hernias. All of these organs are listed on the left. And on the right, what you see here is the report itself, the actual report. And when the application opens up, what you see is that the report is filled with all normal descriptions. So essentially, it means that all the organs are in their normal state, and hence, if the patient was actually normal, there were no problems. You really wouldn't have much to do other than go ahead and print this report. However, when there is a problem, when you do the diagnosis, when you do the scan of the patient and you see that there are problems in specific organs, you would want to start making notes of that. How does that work? Pretty easy, actually. So let's say you start the scan by with the liver. You start looking at the liver and you notice that probably the liver has enlarged a bit, and you think it is a moderate hepatomegaly. Just click that diagnosis here. So in fact, when you do that, it's interesting to note what happens on the report. On your right hand side, you see that the description of the liver has changed. The sentence which read liver is normal in size has been replaced with another sentence which says liver is moderately enlarged. That corresponds to the diagnosis you selected on the left hand side, which says moderate hepatomegaly. But of course, you can change your diagnosis. So let's say you think that it is not really moderate. it's a rather severe case, it's gross hepatomegaly. You select that, and immediately you will see that on the right hand side, the corresponding changes in the description of that organ. Sentence now reads, liver is grossly enlarged. What's also interesting is that you will see that the color of this line for liver has now changed to yellow, while the rest are green. Green means this everything is fine, it's a normal, the organ is in a normal state. Whereas if it's yellow or a deeper shade of yellow, then it means that there are one or more issues or one or more observations that you as a radiologist have had in that organ. Let's proceed. It's also possible that in the same organ, liver, that there are multiple problems. So hepatomegaly is one, but what if the patient has other problems? Let's see. Let's, as an example, look at the patient having portal vein thrombosis. So in addition to hepatomegaly, that is. So if that were the case, you just click on this and you see suddenly here that the text reflecting the diagnosis has been added. That the patient now not only has hepatomegaly, but also has portal vein thrombosis. What's also interesting is that if you go down the report, you will see that in the impressions, these statements are also getting reflected. That the patient has portal vein thrombosis and gross hepatomegaly. So these impressions are added automatically based on the selections you make for each organ and its diagnosis. So that's about liver, but what if the patient has problems in other organs, right? So, and that you might discover while you continue with the scan, you go beyond the liver, you go to the next organ, and so on. So you probably go to the gallbladder and you think, let's say in this example, the gallbladder is fine. So although there are a number of diagnoses listed here, luckily for this patient, his gallbladder is fine, so nothing has to be done. Normal is already selected. The description here represents that the gallbladder is normal. You proceed, nothing to be done for gallbladder. Probably nothing to be done for pancreas and spleen, etc. either. So things are okay. Then you hit the kidneys, and there you notice that there's a problem. Fair enough. And what might that problem be? So let's assume that it's a rather complicated one. It's the hydronephrosis with calculi. So you select that. And when you select that, what you see is in the report, the description of the kidney gets modified to indicate the fact that the left kidney is showing hydronephrosis of a certain severity with calculi at certain locations, right? So how do we fill in these variables? Now we come to an interesting part. So you see this red star that has appeared here. The presence of a red star on any of these lines means that there are variables that need to be filled. So let's do that. When you click this, you see that there are certain blanks. It's like a fill in the blanks, the form, which shows that there are certain variables that you need to fill. So since the patient, we selected the diagnosis that he has hydronephrosis with calculi, so there are certain data fields that we need to provide. So how severe is the hydronephrosis? Is it mild? Is it moderate? Or is it gross? Let's assume it's still mild. How big is the calculus? If there are multiple calculi, how big is the largest calculus that you see? So we can enter the number here. Let's say it's 1.2 centimeters. Need not be centimeters. You can change the units if you prefer millimeters or something else. And finally, where is this calculus seen, or where are the calculi seen? So are they seen in the upper third of the ureter, or in the mid third of the ureter, or lower third of the ureter, or somewhere else in the UV or the PU junction? Let's take this as an example. So you've now done this, and the star here has turned blue, which means you've completed noting your observations of the left kidney. You proceed. Maybe the right kidney is normal, everything else is normal, that's fine. But there's something called renal measurements where you still have some data to fill. Do that. When you click that, the report expects you to make a mention or make a note of for both the left and the right kidney what the bipolar length is and what the parenchymal thickness is. So you enter the right numbers here. Since this is not a real report, I'll just enter arbitrary numbers. This just demonstrates how data entry mechanism works. Okay, we're done. Now, if you see, probably these were all the observations that you had. You want to relook at the impressions. The impression says there is portal vein thrombosis. Yes, we selected that. There's gross hepatomegaly. Yes, we selected that. And then the left kidney has mild hydronephrosis as described. As described meaning as described here. So the description is here. What is the site of the calculi and where the calculi are present. Now your report is practically complete, right? But what you can still do is you can go and edit any line of text you want. You can add additional lines, you can modify what you wish, and that's very easy. So pick a line you want to edit and just click on it. Right? So this line says in the urinary bladder, no mucosal irregularity seen, but you are free to edit it. If something is seen, you can change it. Right? You want to add something else in the urinary bladder, you can add it. So it's just as simple as this. You can type what you wish. It will appear in the final report. Want to delete this line, that's also easy. You can select the entire text and press delete. Oops, the line is gone. So now your report is ready. You've reviewed the report on the screen. You've confirmed that the impressions are right. You've made any other changes you want. You've done all the data entry. Now the report is ready to be saved. And once it is saved, it's ready to be as simple as that. So now this is the print version. And if you press this button here on the top right, it's going to be sent to the printer for printing. So this was a quick demonstration of how the Emrald software can be used to prepare a report. We took you through an example of the male abdominopelvic report. Similar templates, this is based on a template, but similar templates are available for all the ultrasound scans. That includes the obstetric scans, that includes the abdominopelvic and the pelvic scans, and various Dopplers that are done in most ultrasound diagnostic labs. Thank you for listening, and this was